Dr. Bronfort, we're very much looking forward to your Grand Rounds presentation entitled Individualized Biopsychosocial Assessment and Treatment of Back Pain. If you could unpack that title and explain what you'll be presenting.
I've been involved in research probably for about 30 years doing clinical trials. And most of that has been looking at the relative effectiveness of different interventions like exercise, like manual treatment, like medication. And that's the way most of the research has been done in the field of musculoskeletal research, whether it's spine pain or other kind of musculoskeletal conditions. And so I think the world have come to understand that that's probably insufficient to look at individual treatment, monotherapeutic approaches to any of these conditions. And and that's why this whole idea of the biopsychosocial framework was introduced many years ago, and there's been attempts to to assess patients based on that, and it hasn't gone very far. It's getting better now, though, and some of the research that we're involved in now is focusing very heavily on this whole framework of the biopsychosocial profile of patients and trying to match up based on these profiles with this profile match up the treatment to individualize it better. As an example, we talk about the biophysical aspects. That could be things like mobility, strength, and comorbidities, other kinds of physical problems that a patient may have as a predominant feature in their presentation. But most of the time, there are also psychological aspects to that that interacts with this biophysical component. And there's also social or social cultural aspects of people's presentation that heavily influences the whole experience the patient has. So that's the basis for looking at those components and assessing patients that way and matching up treatments with the patient and usually do it in a fashion that's an agreement that you form with the patient of what they are willing to do and what they're capable of doing. One treatment doesn't fit all. So, all of these monotherapeutic approaches have only had moderate effects. And to get to to have more sustained and larger effects of interventions, we're moving towards this biopsychosocial approach.